Patients with early-stage endometrial cancer and a certain change in their tumor have a higher risk for recurrence. But expert Dr. Floortje Backes is leading a national study for these women. Dr. Backes?
Endometrioid endometrial cancer is the most frequently diagnosed endometrial cancer. These endometrial cancers may turn out to have a mismatch repair deficiency, and that is a change in their DNA where they cannot repair their DNA accurately and then can lead to higher risk of development of cancer.
What is the clinical trial that you're leading?
Patients who had a mismatch repair deficiency don't seem to respond as well to chemotherapy. Patients with this specific change in their tumor were more likely to benefit from immunotherapy. So our hope is that this will change the standard of care and result in better outcomes for our patients.
To learn more, visit cancer.osu.edu/blog.